Hi, welcome back to Pace Law Firm, talking with Carrie Brousseau from Source Rehab at sourcerehab.ca. Carrie, tell us a little bit about Source Rehab. What's your mandate? What are you doing?
We run a boutique firm. We only handle catastrophic injury. We do get involved with serious injuries, more on a discharge early intervention time frame, but majority is CAT files. And we founded the company 7 years ago, and we're doing really well. We're no longer just in Sudbury. We're in Toronto and the Bruce Grey and Thunder Bay and Sault Ste. Marie, and so basically Ontario.
Going Ontario wide. I know that I had trouble with this at first when I first started learning about this stuff. I know that there's probably some people out there that are the same. What's the difference? Like, what is the scale of injury? So when you say serious injury versus catastrophic injury, what can people do to put their head around it?
Catastrophic injury is defined by the legislation. So there's categories that you have to qualify to be covered under that accident benefit legislation, which gives you far greater funding. And then if you're non-catastrophic, your funding is very limited. And we're hoping with new legislative changes that we may get an extra $50,000 for the non-catastrophic, but right now the catastrophic have the $1 million limits, and the non-cat have very limited funds.
Now, when we're talking about this, I mean, we break it down into numbers and we shorten things from catastrophic to CAT in terms like this, but at the end of it all, it's people. So what does this mean for the person who is on the cusp of, say, a serious injury versus a catastrophic injury? What are the differences in money that can help them?
There isn't a lot of money, and it's having to be really, really creative. So what we've done, we have occupational therapists on staff that can go in and assess their needs for discharge and treatment, but then to save on their funding, we will have an unregulated professional work with them and implement all of the needs just to save on the funding. You have to be creative with the insurers, because some are very reasonable, some are not. And, if you can be creative and show that, look at the severity. So, I mean, that's somebody who's in hospital more than overnight for observation. It's pretty clear to them that it's serious, right, and their needs are going to be extensive, and it would just be, incredibly difficult for them and their family. So insurers will agree to fund an OT, but now instead of using all the money, their hourly rate is much higher.
We're talking occupational therapists here.
Yes.
Right? Yeah.
So we'll give an unregulated professional's hourly rate and say, okay, it can cost you this or this. And 9 times out of 10, they'll agree to fund it on a very specific basis. You just tell them, we need 4 weeks, and they're pretty good to agree.
I got to be honest, I mean, it's all very confusing to me because I'm not in the industry. The words that you're using are a lot of legislative words and a lot of funding words. What's your biggest source of frustration in the industry right now? What do you think needs maybe some changing or at least some modification?
Just get people the help.
Yeah.
I mean, people are being left and they are catastrophically injured. Their family members in ICU on a ventilator. They may not have the financial means to support a lengthy stay in hospital, away from their home, away from their family. They may have children at home. They're not working. All of that compounds very, very quickly, and the costs of coming to stay in Toronto for these families, they just don't have the monies. And right now, it's really, really unfortunate because it's become very political almost, where the frontline staff have the education and know some of what's available. They're pretty good at knowing what's available, but then they can't do much with it. They sort of have their hands tied because they're told they cannot, refer or direct people to, say, a lawyer or even a case manager. And
this is frontline hospital staff?
Mm-hmm.
So is there anything they can do differently, that they're allowed to do differently, that would help?
I think they have the education. They're being directed, so I think we have to get to the upper management and possibly the CEO of hospitals to have them understand the money savings for the hospital, because they're all running on a tight budget, and also letting their staff have some leeway and maybe working with what will work and what won't work. I see case management as a healthcare service, which we are. They're entitled to it in the legislation. So a referral to a private case management company opposed to CCAC is really, there's no difference other than we're covered under the Insurance Act opposed to the healthcare system. And again, it allows the healthcare system to save money.
Obviously, we're sitting in a law firm, so I might as well ask you, how can lawyers help you?
I think education is a critical component. And, you know, having the hospital frontline people, and it may not just be social workers, the nurses, the ER docs, the ICU docs, just having them educated as to what is available and maybe getting their interest a little bit more just because of the deficit they're running in. I mean, they're always looking for funding, and I'm sure they would be a little more open as the budget gets tighter and tighter. But I think, again, it's their hands are going to be tied politically to some degree, but getting up to the upper management and showing them by having a solid law firm involved, and solid is very important. There's a lot of people out there claiming that they know accident benefits, and we see it all the time, that these clients aren't receiving the expertise they should. And normally if we run into a snag and we can't get something that this client needs, we do access the law firm, and hopefully they can send a letter or speak to a supervisor and, you know, keep the ball rolling. So it's imperative that a solid, reputable law firm is involved.
So what's Source doing that's different than other rehab companies?
We're trying to be the leaders in our field. I have very educated individuals working on my team. Our whole philosophy is client, client, client. There are an outer team of professionals, which include the physicians and hospitals, the lawyers, but also the insurers, and, you know, just trying to keep us all together rather than having disputes just because of personality and the client is the only one who suffers. Being very creative, and our team is trained to almost, not that it's not take no for an answer, but when you get a no, that's not where you stop.
Okay.
You keep going when you know it's a true need of the client, and how can we help the insurer be able to say yes. And I mean, they're audited, they have someone to answer to, so we have to make it easy for them to say yes as well. We attempted to help them immediately following the accident. They're overwhelmed. They have forms to fill out. They don't know which hotels, they don't know what benefits are available. So we did create this logbook, which
I know you've been playing
breaks
with that.
it out.
I was waiting for you to break it out. Let's see what's in there.
And just useful numbers, an area to keep receipts, appointments they may have, which are endless, their expenses, and it's identical to the expense sheet that goes to the insurer, so they fill it out, can rip it out, give it to their lawyer to attach to an OCF6, and a daily log so they can keep track of, you know, when their loved one left ICU, or the trach was removed, or the surgery occurred. So it's all in one book for them, because they end up with little papers everywhere, and their memory is sort of erased, hopefully, after that traumatic event, and they start to remember things down the road and not so much detail in the beginning.
Wow. All right, and sourcerehab.ca is where to find you, phone number and everything else on there, and contact details.
And any questions?
Okay.
Yeah.
Thanks, Carrie, for stopping by. Carrie Brousseau from Source Rehab, sourcerehab.ca up in Sudbury, but all across Ontario. You can find us, of course, at pacelawfirm.com, and we'll see you next time. Bye.